So another big thing that happened this week is I was tested for COVID twice. Hey everybody, welcome back to my weekly update. If you're new here, my name is Heather and this is my week 34 update for baby number 2. If you're new to my channel, don't forget to subscribe and click that little bell for notifications if you want to know when I post my next video. Also head on over to Instagram and follow me at the Gingy Pants, where I post day to day on my stories where it's just real raw life watching my family and my toddler grow. So week 34, how big is the baby? The baby is about 5 pounds and 18 inches. That's about the size of a butternut squash. And it's actually like just the size of a normal baby. Like so many babies I know are born at 5 pounds. So I'm like, oh my gosh, she's gigantic. I keep looking at my belly thinking there's a whole big baby in there. Development this week, the little fingernails and toenails are fully grown in by now, meaning that they're at the tips of the fingers. Your baby can now open and close its eyes, and research has shown that the pupils are actually reactive to light already. How I'm feeling physically, just tons of pressure in my back, like I want to crack it. I just want to get on the floor or have somebody, bear hug me and shake me and just crack my back, and I want to hear I asked my husband to do that for me and he won't do it. He's just nervous. You've read things about don't crack your own back, go to the chiropractor, so he doesn't want to screw anything up. Symptoms this week, I've really noticed on myself a lot of nail growth. I cut my nails the other day and they're already like irritating me and they're ugly and long and unmanicured. Baby hiccups a lot. I just feel her hiccuping a lot, and like I said last week, it's just a symptom of them trying to learn how to breathe in the womb, inhaling the amniotic fluid, and then it causes baby hiccups, so it's a good sign. Sporadic back pain, then again restless legs. I'll be sitting on the couch or in bed and my legs are going crazy. Along with when I have that restless legs, I'm trying to stretch out my legs in bed and getting these crazy cramps in my calf to the point where I thought I wasn't going to be able to walk when I got out of bed. And from what I've heard, there's sprays and stuff that you can put on your legs to help with that. But another easy thing is just stay hydrated and eat bananas. Braxton hicks, they happen sporadically, not enough in a row to be concerned, but just my belly tightening up, my uterus getting ready to contract, hopefully, and push this baby out. And then tired, just really tired by the end of the day, especially if I'm sitting out in the sun. I just feel exhausted quicker than I would ever feel exhausted if I weren't pregnant. And acid reflux, which could be just acid indigestion. Tums, I'm just constantly, like I take one to go to bed, and then if I wake up in the middle of the night, I'll take another one. Cravings this week, typical ice cream, watermelon, definitely I had to go out and buy another watermelon. I think my husband probably thinks I'm crazy because he doesn't eat watermelon, so who eats it? And then the whole watermelon disappears by the time the week is over. I tried to give my son watermelon and I'm like, darn, he must be just like my husband because he doesn't really care for it. But it's sweet and it's hydrating, so I don't understand why he wouldn't like it. How my weight has changed, I'm about 147 pounds right now, which means I am up about 27 pounds. I forget what it was last week, but I think I'm just consistently on a consistent weight gain. My waist this week has not changed. Thank the Lord, because if another inch came to my belly, I would start freaking out thinking 5 more inches is gonna add on by the time I reach my due date. So that's comforting to know. No swelling in my legs yet. I am kind of worried about that because when I was working, this is my vacation week, it's technically not maternity leave yet. Maternity leave will start next week, which is 4 weeks before my due date. I'm not working this week, so I'm not wearing my compression socks, which were from my foot up to under my knee. I think that had a lot to do with not swelling, but also I didn't have any swelling with my first pregnancy, but they say girls are different than boy pregnancies, so we'll see. But so far, no swelling in my legs. I do notice that the veins in my belly are super blue, like really noticeable, to the point where sometimes I take my weekly photo updates for Instagram and I'm like, they look like stretch marks, but no, I'm like, no, they're not. They're just veins. Things we did this week, I had my 34-week OB visit and I had that with a midwife, which was always great because I love the midwives. I love their personalities. I love their vibe. They talked a little bit more about VBAC and just encouraging, but again, I said, depends on the baby's position and we'll just take it one appointment at a time. So she did confirm that the baby still feels like she is head down. She is measuring spot on from the measurements that they're doing. And she said the heart rate was great, and overall the baby just looks and seems great. I did ask her about my discharge again because now I'm noticing that there is like a slight tannish color to my discharge, which is kind of suggestive to bleeding. But she didn't seem concerned. She seemed like, okay, well, we'll just monitor it. I reminded her that I did the treatment of the cream that was inserted. So she said maybe when I was inserting it, the tube that was inserting the cream could have scratched something inside, and maybe it's just residual that's not healing, but I feel fine. I feel the best that I've ever felt down there. No issues. So it's not like a consistent thing that's getting darker or more brown or traces of bright red blood. So I'm just kind of keeping an eye on it. Nothing has changed drastically with crazy contractions or me noticing any water leaking or anything like that. So just gonna kind of take it day by day and let it go. They didn't seem concerned, so I'm not concerned. Some information that they told me right off the bat is that my hospital will be doing a mandatory COVID swab on admission. So I guess if you're going into labor or anything, they're going to swab you, and then within 45 minutes, they will have the result. I don't believe that they're going to swab my husband or their significant other or support partner or anything. I think they just will do a temperature check and then the questions. But obviously, she said if you're coming into the hospital and you're in labor, like you're going to push out this baby any second, they're going to gown up and they're going to treat you as if you are a positive patient. So maybe get there a little earlier so that doesn't happen. I asked my midwife, is there any information that you really love to give out to your patients that are trying for a VBAC? The website that she gave me was www.childbirthconnection.org, and I'll link it here. I haven't really got the chance to look into it. Life is just so busy. I just feel like life is always so busy. This pregnancy is just flying by. I still have to look into VBAC stuff. I did come across some things like positive affirmations, so I am going to start just saying positive affirmations to myself and then looking into other information that's going to be encouraging and motivational to give me some motivation and not be scared, because I'm scared. Vaginal birth scares me. I mean, C-section scared me, but now I know what to expect, and I think just the thought of not knowing scares me even more right now. I just feel like there's so many women and so many babies that are giving birth early. A friend of mine at work just gave birth 7 weeks early. Another friend of mine gave birth at like 30 weeks. Another one gave birth at 38 weeks. So it's just like, is she gonna be early? Is she gonna be stubborn like me and come late? So another big thing that happened this week is I was tested for COVID twice. I had the nasopharyngeal swab. Actually, it was not because I'm symptomatic or because I request it. Where I work is a long-term care facility, technically. A couple of the floors are. So mandatory by the state, they are requiring staff to be tested. Just so happens I was there for that last week before I left work, and that was the week that it became a mandatory thing. I was able to go into work on Monday, have my swab done. I had my results by Wednesday, which were negative, and then I was able to be swabbed again on Thursday. And then I left for my last day of work on Friday. Both tests are negative, and I can go into maternity leave just positive that I am in the clear right now, and knowing like, okay, I am safe. I want to stay safe. Let me isolate, let me quarantine, and just keep it that way, because I don't want any threat to my delivery or holding my baby once she comes and all of those things. Another thing that happened, and if you guys follow me on Instagram, you already are up to date with this, but my son decided to run and his crooked little feet just tripped on them, and he smashed his face and his nose on the concrete and chipped both of his front teeth. For my husband, because he was the one that knelt down and he, open arms, said, "Come run to dad," and smashed his face right in front of him, came in the house, blood gushing out of his nose, 2 chipped teeth, and then over the next, not even a week, his 1 tooth chipped even more. We were just kind of dealing with that. I asked a lot of you your thoughts and what we should do, and obviously with the whole COVID thing, it's hard to get him to a pediatric dentist because things just aren't open. And come to find that he wasn't even on my dental insurance, so we would have to add him on, find a pediatric dentist, go there, and most likely they weren't going to do anything about it. So long story short, everybody said watch the teeth, watch for discoloration, watch for any abscesses on the gums, wiggle them, see if they're loose, keep him on a soft diet. So we did all of that. We've been monitoring him. My son is now up screaming and my husband's going to go get him. So I'm just gonna try and power through as much of this as I can before he comes out. Okay, so if I didn't talk about this already, which I forget what I talked about in my last weekly update, this past Friday was my last day of work because I scheduled a week vacation at the end of May, and then June 1st will start my actual maternity leave. And I clarified with work because I did post on my Instagram and a lot of you were asking what and how are you getting paid. And I have no idea why it's so different for all the states in the United States, and then of course in Europe and Canada and like everywhere else in the world. They get so much more maternity leave, which I don't even want to talk about because it frustrates me. You know, people in Europe and wherever you are and you're getting full paid maternity leave, you are so lucky. But we get 4 weeks before and then 6 to 8 weeks after, depending on vaginal or C-section delivery, which is paid in disability. And then after that, you can apply for bonding time, which is up to 12 weeks, which would be paid by, I believe, your FMLA. To celebrate as my last day of work, my husband, my wonderful husband, cooked these colossal snow crab legs and filet, and we had a wonderful dinner to celebrate the fact that I can now stay home and be safe and just finish out my pregnancy and be confident of that. So my second to last day at work, my friends at work threw like a little baby sprinkle. They had a cake, they had some food, they all gave little gifts for baby girl to welcome her into the world, and it was just so sweet, so unexpected because they did this beautiful baby shower for when Cole came, and I just feel so blessed to have them in my life, and everything that they did for me was just so nice and unexpected. My husband made a list of what to crack down and get done before baby girl gets here. So he had a giant list of things that's over there. Painting closet doors, doing this, like little things around the house, getting air conditioners, just tons of stuff to get done before she gets here. And he checked off like 5 things already in the last 4 days. Very proud of him. So I made a list also. I'm just gonna read from it. It's what we need for baby girl. So I haven't finished, but if you guys hear anything that I haven't said, can you just please leave it in the comments, because I'm still trying to like collect myself. So things that we need are diapers. I want to get water wipes. We need a new baby monitor, a new changing pad, either replacement breast pump parts or a new breast pump. I haven't decided on what I want to do. I really did like my old breast pump. I think that it will work well for this pregnancy, but I just have to get new parts. They do suggest that you swap out your parts at least with each baby, or every so often, because they do dry out and then crack and then they won't work properly. Baby swing, which I am borrowing from a friend. The Upper Baby double stroller attachment, which my friend also said that we could borrow, so that saves us there. I need to get more milk storage bags, new bottle brush, which I have in the closet. I would like another Hatch sound machine because I think it just works so well in Cole's room and it's the best sound machine ever. We need to get a second car mirror, but technically if we don't get the second car mirror, Cole's not coming to the hospital. They're not going to be in the same car probably for a while. So I mean, if I don't get that right when she comes, I'll be fine. So when she's born, we'll get the pacifier that she seems to take, new bottles. I didn't use bottles with my son for a while because I nursed him straight off the boob for at least 3 to 4 months. But I think this time around, I might want to give Joe the opportunity to give her some bottles and then me take a break and rest or sleep. You know, those night feeds maybe. I don't know. I do enjoy the bonding time and just nursing with her. Doing bottles is a mess. Like, there's so many parts that you have to clean. It's just, sometimes it's not even worth it. It's just easier to just whip it out and be done with it. And then you don't have to clean anything. You don't have to sterilize anything. So when she's born, a new mattress or a toddler bed for Cole. Don't know yet. So I don't know. But that's something that it's not going to be a rush to get now because she's going to be in a bedside bassinet with us. We have one, but we are looking into getting a new one. So don't know which one yet. Let you guys know. And then of course sheets for her. One thing I want but I don't need is that baby shusher. It's like this big and it just makes that shh, like the constant shushing sound. I just feel like that is something that I would do a lot with Cole, and I don't know, it seems like it could make life easier. When I did Cole's baby photo shoot, they used that with him and they had it right next to him to keep him calm to do his brand new newborn photo shoot. Again, it's something that I think is cool. It's probably like $30, but I don't need it. Things that we have to do on my checklist is put the car seat bases in the car, bring up the old car seat, which is the Upper Baby Mesa, clean it, make sure it's clean and ready for her. I'm pretty sure we cleaned it before we put it away, but just need to check on that. And then bring up all my postpartum stuff, like the DockATot, the My Breast Friend nursing pillow, the Boppy, the Baby Bjorn bouncer. Like those are all things that I swear by. I just want to make sure that the cloths and everything are clean and I don't know, bring them up and have them here because God knows what's gonna happen. I feel like she's gonna either come early and it's gonna be beautiful, or she's gonna just not progress and I'll end up in the C-section. So I don't know. Knock on wood. I just don't know what's gonna happen, and I have this crazy thought of her coming early in my head, so we'll see. But now I'm like, because I have that thought, it's more of a kick in the butt to get crap together. So yeah, if I missed anything on my baby number 2 list, definitely comment it below. Last thing that we did this week was a virtual photo shoot. So if you follow me on Instagram, you got the tail end of that. I didn't get the photos back yet, but a lot of these photographers are coming up with such great ways to continue their businesses during the whole pandemic and quarantine and everything. So what it was is a woman reached out to me and said, can we try this? And I was very open to it. I just had my tripod and my ring light and my husband, which was the best idea ever because I don't know how I would have done it myself. I mean, it's possible, but it was so much easier for him to set it up and then me be just waiting there to pose. So what she did was, I don't know if she took photos of the camera or screenshots or what. I'll probably get more information when she gives the photos. My son is up now. But it was so cool. She gave me a few outfit ideas to wear, and then she just directed me how to pose, where to put my leg to make it look better, and it's just things that I wouldn't have been able to think about myself. Looking forward to having those photos, and if we don't end up getting a photo shoot done, then at least I have those. They are, of course, not high quality. They're more for like Instagram sharing or just, you know, having for yourself or sharing with family, but it's the memory that counts. You know, it's capturing that moment, the look, and everything. How am I feeling emotionally? Well, after a whole smashing teeth thing, I was very emotional. My husband and I both felt like, oh my God, we let our baby break. And there's nothing you could do about it, but it was just, you know, I think it's hormonal. He's fine. He's running around. He was fine like a short amount of time afterwards. But I think one of the things was just not knowing where or what I was going to do with the whole dentist situation. Like, we don't have it set up, and it's like normally I have answers, but I had no answers. I didn't know what to do. I gave him Tylenol initially, just thinking like, okay, he's going to have pain. There's going to be some sort of swelling. And then I tried to put ice on his face, but he wanted nothing to do with ice on his face. Okay, say hi. You got your ninnies? We call pacifiers ninnies. Say hi. Stand up. Ooh, ooh. You want to run around and do what you want to do. I know. Say hi. Say hi. All right. Bye. Also, emotionally, I was just sad and happy at the same time because of my last day of work. Work was my getaway. I was able to leave the house and do it with no judgment because I'm working, and now I just feel like I'm gonna really have to isolate, and it's gonna be hard because all of you have been isolating for this last however long, month and a half, 2 months. And I've had the opportunity to go to work. I mean, yeah, it was scary and I had my fears and everything, but I had the opportunity to socialize with people. And I hope that doesn't affect me in a negative way. I mean, it's beautiful out. I'm going to be able to be home with my family and outside. So I just want to keep myself safe. I know that I'll miss the interactions of going to work and my normal routine. Other women have said that their doctors are suggesting strict isolation from 37 weeks on. What's comforting to me, just feeling her move, the strong trembling, really big kicks is always comforting. And the fact that my husband can see it and feel it, and it was almost to the point where we thought we could grab Cole's hand and put it there and let him feel it, but of course, whenever you do that, it just stops. And then also the peace of mind of having the 2 COVID tests and the facts of knowing that they are negative. Even if one was a false negative, like I had the test again. So the chances of having 2 false negatives, I feel like, is way less than just one, and blah, blah, blah. Things I'm looking forward to, just figuring out what we are going to do for maternity photo shoot, like an actual one with high-res photos, and hopefully being able to get a family photo. With the virtual photo shoot, I said let's save it for last because Cole was napping the whole time. I just knew he wasn't going to cooperate. Just like when he wakes up now, I tried to hold him and he wanted nothing to do with me. So imagine trying to put him in a little outfit and then being like, take a family photo with us. It didn't work. Things I'm scared or nervous about this week. Definitely, I mean, there's always that thought of I hope she doesn't flip, because there still is a slight potential that she could flip around. But knowing that this week's visit she was head down is comforting. And I think the further along you get, the less likely it is to happen. But I know that it has happened for some people, so there's always that thought. But I think that she's pretty comfortable where she is. And the midwife did tell me that we could do a late ultrasound, which would be around 38 weeks, and it would basically just be for positional check. It's something that I'll consider. I'll see what they say when it gets closer to 38 weeks. I'm currently now day 1 of 35 weeks, so it would also be cool to see her little face possibly, but I know by that time they're so crammed in there, like you could basically not see anything. And then I'm just scared about vaginal birth. That's one of my fears, and I'm gonna just need to suck it up. I think that when the time comes, it'll all just happen so fast that your instincts will take over and the fear will kind of just be turned into excitement, and you gotta keep it positive energy. And I'm gonna look into more of just breathing and keeping yourself calm and not looking at it like a weightlifting activity, like, ooh, I gotta push it out. Like, I think more of the mental breathing and being calm and letting your body do what it needs to do and open up is more of like the vibe that I want to have. A lot of people have said stuff about hypnobirthing. I didn't get a chance to really look into that, so if you have any information on that or links or pages that I could read, leave that below. So that's it for my weekly update this week. I am definitely going to start nesting a little bit more next week, trying to find time to really research into vbac. I know I said that the last couple updates, but as you can see, I'm a procrastinator. Don't forget to subscribe to my channel and click the little bell for notifications, and then follow me over at the Gingy Pants on Instagram. Let's take a look now at how my bump is progressing. All right, so this is my belly for week 34, day 1 of week 35. Thank God I didn't grow too much this week. I'm still feeling really stretched. My belly button's crazy, but we're getting there. 5 more weeks.